All right, we're having people join. Welcome, welcome. Hey, hi, Nicole. Katie. Belle Steiner's here. Hey, how are you? Yay, yay, yay. Welcome, welcome. Remember, worksheet on my website. Make sure that you print it off because these are the cases we're going to go over and talk about antibiotic use. Make sure you go to www.drcrockerpetvet.com and print the worksheet out. It's the number 2 one. Okay, we did this last week. Y'all were awesome. So much good info. And I had a couple people jump on with me. So make sure you print off the worksheet because we have 8 cases we're going to go through. Dr. Shauna, hi. How are you? I'm so glad all y'all are joining me. I know it's kind of a different time. I have an emergency shift tonight that I picked up, and so I have to go in, and I can't do it tonight. So I decided I'd do it the middle of the day. I'm glad so many of you are able to join me and meet up with me. Again, worksheet. Amanda, what's happening? I bet you guys are building furniture. I saw some pictures of that. I'll let everyone get on. And I did get up the last week's episode. I finally got it up on my website. So if you want to print off the sheet from last week and you can go through and watch that video and fill it out along the way, that would be awesome. One Random Muskins on here. You answered the questions really well last time. Dr. Ham, eating lunch and tuning in. I know, multitasking right now is a must in our world that we're living in. Greetings from Iraq. That's awesome. I love hearing and seeing people from other countries, even though sometimes I feel like the names of our stuff is a little different. But hopefully it's still helpful. And I am recording this on my computer. And I also have it on here. I'll try to save it at least 24 hours and record it. I figured out how to record them, which was exciting. Okay. So I figure not as many people can join us because it is the middle of the day. Oh, Lebanon, that's awesome too. Again, make sure you have the worksheet. I'll try to state the cases, but it's going to be easier to read them too. And we will get started. Courtney, yay! Glad you joined. Lacey, what's happening, girls? I hope everything is going well. I know everyone's like in it with school, so I love this. Aaron's on here. Yay. Okay. Worksheet. I'm going to give it 2 more minutes because people are still joining. And I'll also give you a chance to go get this off my website if you don't already have it. Definitely need the worksheet to work through the cases. And I appreciate those of you that messaged me with questions from last week. Hopefully I was able to help and answer out. Life of a Vet. Hi, what's happening? The website is www.drcrockerpetvet.com. And you can go there and there's a resources page, PDFs, and it's antibiotic worksheet 2, because we did this last week. It was pretty successful. I think people enjoyed it. Today we're only going to go through 8 cases because we did 10 last week and we barely made it through the 10 cases. So wanted to make sure that this week we could get through everything. And like I said, different time because I'm going into the emergency room tonight to work shift. So things are working and happening for sure. Okay, let's get started. It's 1:05 and it looks like people are done joining. Hi, Jasmine. How are you? Okay, case number 1. Case number 1 is a 3-year-old female spayed indoor-outdoor cat who presents for fever and lethargy. Okay, an abscess is found on the rear of the cat on exam. So remember, we're talking about antibiotics in practice, antibiotic use. So there's a lot of things we can talk about treatment-wise, but we're trying to focus on the antibiotics more than anything else. What's up, DVM? How are you? I'm so happy to see so many familiar faces in the middle of the day. I love it. So a cat with an abscess on the booty. So what are you thinking? What do you need to do treatment-wise? Is there any diagnostics you need to do? And antibiotic-wise, what are you thinking? So Anna Banana jumped in, not sure how to say it, but jumped in and said, you don't necessarily need antibiotics, you just flush and debride. And I do think that's a really important point to make. I think that a lot of these, I will just flush them and leave them open, and they will heal without antibiotics. A couple times I will use antibiotics. When do you think you do use antibiotics with these? And if you do use one, what antibiotic choice would you use? Let's see if anybody can answer that question. Hi.
Hello.
Hello. Let us know who you are, what school you're from. What's your story?
I'm Anna. I go to the Royal Veterinary College in London.
Love it.
And I'm going into my 4th year.
Awesome. Well, you hit the nail on the head with a majority of the time these guys, I don't do antibiotics. Why do you think that is, or what have you been taught is the reason?
We've just been taught that if you do a thorough job with like debriding and flushing, you can actually mechanically get rid of the bacteria. So you don't necessarily need to provide like antibiotics. I guess if you do that, and maybe if you still find that the cat's having symptoms and it's not going away, then possibly like culture or take a sample from the site and culture it. But I've also heard some people using clindamycin for abscesses.
I think,
not really sure.
Clindamycin gets good abscess penetration. A lot of these cats are indoor-outdoor, and a lot of times the only reason I do antibiotics is because there's like a lot of cellulitis and local, does that make sense? Like irritation. So sometimes that abscess is like, it's too ahead and you bust it open and you clean it out and you don't need them. But if like there's a ton of swelling and heat, and if they have like a really, really high fever, and I'm worried about, you know, it being more than just local, I will do an antibiotic. And I probably only do that like 1 out of 10 of them. I probably pick Convenia the most because they're indoor-outdoor cats, and a lot of times the owners don't have them in regularly enough to like give them oral antibiotics. But I do think clindamycin's a good option for sure, especially for an abscess. What do you guys use Convenia over there? I know some of the drugs are a little different.
It's just cephalosporin.
Yes, and it's the injection you give, and it lasts for 2 weeks. Yeah. So that's great in cats.
I think it has a different name, but yeah.
Okay. It's funny because people will post things, you know, from like other countries, and I'm like, wait, what is that medication? And I don't always like the trade names. I'm like, I don't know for sure what it is. So that's awesome. Well, I appreciate you jumping on with me. I just was impressed that you like nailed it, you know, right away, first question. So thank you for watching, and keep it up, okay?
Thank you.
All right, good luck in school. Oh, Southern Pet Vet is on here. That's exciting. How are you? She's got some awesome stuff up on internships. You guys need to check it out. Definitely make sure you go and check out her account because she's been doing some awesome stuff with Dr. Brittany too. Okay, so abscess. You don't always have to give antibiotics. If you can drain them and flush them really well, you usually don't. If you're gonna give an antibiotic, usually Convenia because they're indoor-outdoor cats. And really no need to recheck these guys. They will heal up beautifully. You'll be surprised by how well they do. Okay, case number 2. A 2-year-old male Labrador who presents for a broken toenail. It occurred 3 days ago. The nail bed is very swollen with yellow exudate and is otherwise acting normal. Dog feels great. So what do you need to do diagnostically for this pet? And then what antibiotics are you going to consider? Or do you even consider antibiotics for a broken toenail? Let me know what you guys think, and we will talk about it. Obviously, you're going to do anti-inflammatories and pain meds. Broken toenails hurt, and especially if they have a lot of moistness around the nail bed, there's a little bit of infection or swelling, they definitely need to do pain meds for those guys. A lot of times, if they're really loose and they're not very deep and there's no infection, you can just remove the nail and they feel so, so much better, and you don't need to do a ton of medication. But on one that it's been a couple days and it's really swollen and the nail bed is kind of moist, definitely I would consider antibiotics. So Cytology, cytology, Rimadyl and Polyflex, cytology flush, yes, remove the nail, impression smear. Okay, so I get where you're coming with cytology. I don't do cytologies on these. Most of the time, if it looks obviously infected, it's usually a bacterial infection. I actually will offer x-rays on these. And I will tell you why. It's because I had one, I've actually had a couple now, where the toe nail was broken, but the toe was also broken. So the bone was also broken. And I think it depends on the dog's level of lameness sometimes, but I now always offer an x-ray because there is a possibility with a broken toenail that there's also a broken toe. And so it's just something to kind of keep in mind and consider. I do think it is important to offer, you know, everything that you can. Most pet owners say, we'll just monitor for a little bit, and most dogs heal up really, really well. I don't do cytology though. Majority of the time, if it's going to be a bacterial infection on the foot, it's going to be staph, and I will usually reach for clindamycin because you also have kind of some bony involvement right there and soft tissue involvement, and I really think it gets great penetration of bone and soft tissue. So my antibiotic of choice is clindamycin, and it just works really well for me. I'll only do like a 7-day course of it and a 7-day course of anti-inflammatories like Rimadyl, and the dogs usually do really, really well and don't need any other follow-up. But I do think imaging of the area, if it's been really traumatized and it looks really infected, is important because you want to make sure. Yes, Erin said you want to look for lytic bone changes too. Sometimes there's a reason that the toenail broke. It's a 2-year-old lab, so cancer is less likely, but it's always good to be really thorough. But cytology is never a bad idea, but I would say if you do it, you will probably over and over and over see cocci bacteria and probably find that's really common. And so it seems like the treatment works for me without cytology, but I never think cytology is the wrong answer, especially if the derm vet was on here, I'd be saying, yes, cytology, definitely, for sure. Okay. Case number 3, we gotta keep moving. Case number 3 is an 8-year-old male neutered Yorkie. Presents for vomiting and diarrhea, lethargic, not eating or drinking, and tense on abdominal palpation. So what diagnostics are you thinking and what disease are you thinking with this presentation? Abby wants to know, do I use opioids or anything to sedate and remove the nail? It depends on how firmly it's attached. Honestly, most of them are really loose, and just grabbing it and pulling really quick, it'll be off of there. And it's more to put them through like full sedation, especially if we have a recent lab work or if they're older. So I usually don't sedate unless it's really, really attached. Okay, so yes, Dr. Ham, you are just so good. Blood work and a test for pancreatitis would be at the top of my list. This is a Yorkie, y'all. Yorkies and terriers get pancreatitis. Little dogs, scruffy dogs get pancreatitis. It is like rule out pancreatitis on any little scruffy dog that is not eating because they get it. Sometimes they're not even throwing up, they're just not eating. But for some reason it is really, really, really common in them. I do like ultrasounding these too sometimes. It really just depends on the clients and the level of compromise in the pet. So this pet had pretty unremarkable lab work, a mild ALT elevation, but the pancreatitis test was abnormal. So it did have pancreatitis. So again, we're focusing on antibiotics. What antibiotic are you considering, or what would you do as your next step for treatment for this pet? I will tell you, for my pancreatitis, is if they're not eating and drinking, I always recommend hospitalization. One, because they're super painful. I had a friend that got pancreatitis, y'all. She said it was like the most painful thing that she's ever been through. So I like hospitalizing them and putting them on some really, really good pain meds. And then I also like to make sure that I'm giving them fluids and injectables because they're not eating. Now, if the owners really can't afford hospitalization or they think they can get meds in them at home, there's definitely some things that you need to do for sure. So Day DVM said fluids, bland diet, and Cerenia. No antibiotics necessary. Opioids, hospitalization, fluids, nutritional support, fluids, Cerenia, bland diet. Erin's on it. So Cerenia is a must, I think, in these guys. It is good for anti-nausea, and it's also good for pain relief. I I like fluids. If they're going to take them home, I do sub-Q fluids. Not ideal. If they're going to hospitalize, obviously IV fluids. Low-fat diet. Yes, Abby. Low-fat diet is really important. Fat sets these guys off. And I will tell you, if they have had 1 or 2 rounds of pancreatitis, we're putting them on a low-fat diet the rest of their lives. Hi, Becca. Welcome. Totes, my goat, said Pepcid. I do like something for acid. I prefer Prilosec over Pepcid, but I do like something for acid. So I will usually put these guys on some form of fluids, a low-fat diet or bland diet, Cerenia, and Prilosec. I will say, yes, a lot of people say you don't have to use antibiotics, but if they are having diarrhea too, I do put them on metronidazole. I think it clears up faster. Metronidazole has some anti-inflammatory effects also, which I think are good for the GI system. This dog had a slight ALT elevation. I like antibiotics when I see that. And so I do antibiotics if I have diarrhea and vomiting and not eating. If they're just not eating, or if they vomited a little bit, but there's no loose stool, I don't always do antibiotics. But if I pick an antibiotic with pancreatitis, I'm going for metronidazole. And I usually will do 12.5 mg per kg twice a day for about 7 days. And usually they will see really, really quick improvement within 2 to 3 doses. So that's kind of my protocol with pancreatitis. I see a ton of it. And it really does seem like they respond well to that. But yes, you don't have to use antibiotics for all of these. And I know we're talking about antibiotics, but I wanted to throw in some cases where maybe you wouldn't use them. Does anyone know, this is like just FYI, what is one thing that you would probably potentially give a cat with pancreatitis that you don't give dogs with pancreatitis? Does anyone know what that is? That there's a treatment medication that you might give cats for inflammation that you wouldn't give a dog that has shown to be beneficial? Anybody? If someone gets this, I will send you a sticker because it's kind of tricky. Toast my goat, B12. B12 is great. I love B12. Not necessarily, I mean, any cat not eating should get B12 100, but that's not what I am looking for. Anyone else? It's something that you don't always jump to. Ah, Abby, what? Yes, send me your address. I'm sending you a sticker. Steroids. So cats with pancreatitis get steroids. They respond really well to it. It quiets down the intestinal tract and the pancreas. Dogs don't get steroids because dogs get steroid-induced hepatopathy and their liver's already angry. But I feel like these cats do dramatically better if they get steroids. I don't always do pred. Sometimes I'll just give a dose of Dex SP. But I do think that cats and pancreatitis respond well to low-dose steroids. So that's just my 2 cents and a little FYI for the difference. I'm so glad I agreed with an internist. You're making me feel like I maybe know something. So that was awesome. You did so good. I appreciate the information. Okay, let's do the next one. Case number 4. A 12-year-old Hi!
Hi!
Introduce yourself.
My name's Abby. I'm now 4th year at K-State.
Yes. Oh my gosh. So K-State's going to have the STABMA Symposium next year, I think.
Yes.
I am gunning to come and I want to meet everybody.
That's awesome.
Yes. It would be so awesome to come and see all the students and just meet everybody who's really excited about vet med. So no, but it's funny because steroids usually are contraindicated in a lot of things, especially GI stuff, because they can cause ulcers, right? And so I honestly only heard about using it more for cat pancreatitis 2 years ago. And I was a little nervous first, but I see huge difference in them.
Yeah, Dr. Dugan says she uses it only in cats, but she's noticed the same thing. And there's a couple AVIM articles about it, so it's interesting.
That's awesome. Well, definitely make sure that you send me your address. And I will send you a sticker if you want a Black Cats Rule sticker, a Dr. Crocker one, and you can sport it. But thanks for participating. I appreciate it. And hopefully I will meet you at STABMA Symposium next year. Okay?
Yes, that'll be awesome.
All right, good luck with 4th year. Thanks.
Thank you.
You guys are impressing me, all these students. I love it so much. Okay, case number 4. 12-year-old fractious female cat presents for drinking and peeing excessively. Had normal lab work 2 months prior. So what diagnostic are you going to try to do? And what is the key word in this case that really stands out to you? Oh, Taz Bailey, while we're answering this case, can you repeat why dogs don't get steroids for pancreatitis? Because steroids cause dogs to get a hepatitis. Their liver doesn't always love steroids, and so you can cause more issues. Steroids also cause GI ulceration and GI bleed sometimes, more so in dogs. So cats tolerate them more than dogs do. If you have a dog that's already vomiting or having issues and sometimes liver elevations with pancreatitis, want to avoid steroids. Hopefully that helps. Okay, so you would love to get fructosamine, UA, blood work, urinalysis, CBC, worried about kidney disease. Yes, yes. Okay, Abby hit it on the head again. The word that stands out is fractious. So this cat is really difficult to handle, and you can't get anything. You can't get any samples. You can't get any diagnostics unless you sedate this pet, and they do not want to sedate this pet. So if they had normal lab work 2 months prior, because you sedated them at their wellness exam and got everything, and now they're drinking and peeing excessively, and it's a fractious cat, what antibiotic of choice are you going to use? Because the owners say, we don't want to sedate, we don't want to do blood work, we don't want to do urinalysis, we think it's probably UTI. So what are you going to give this cat? What are you going to recommend? And this is like real practice, real life, guys. I would love to do all the tests and do all the things. You will not get to do that. And you sometimes have to pick the most likely thing. Luckily in this pet, we had medication or had blood work recently, but a majority of the time, you may not even have that, and the owners are going to decline it. And in a cat that can't be handled or managed, it's tricky. You could keep this cat overnight on a urine grate and try to catch urine, or do some no-sorb litter at home. Someone said, can you owner medicate at home? So that is the key question. Can the owners medicate? Y'all, cats are super tricky and super difficult. Majority of the time, yes. For UTI, I'd say Clavamox all the way in a cat. These fractious cats are tricky and difficult. And if they can't medicate, then it's not doing you any good sending them home with an oral antibiotic. So this is a conversation with an owner communicating, but a majority of the time, Nicole and Abby are right, we're gonna do Convenia. And I don't love Convenia. I don't love cephalosporins for UTIs. And I think Convenia is overkill for a basic UTI. But if an owner can't get any antibiotics in a pet because of their behavior, then you have to use what is available to you. And fortunately, I would say Convenia helps 8.5 out of 10 of these cats, and they do really well. But you definitely have to work with the owners to have compliance, because sending home an antibiotic that might be the best choice, but if they can't get it in them, it's not going to work. Dr. H wants to know, is Convenia cefavecin? I don't know. It's a Cefa. It's like a 3rd generation cephalosporin. I don't know. I always forget what the real name is. Maybe someone who can look at their box can let you know that. I don't know off the top of my head, and I probably should know that off the top of my head. But maybe someone can throw that out there. Okay, case number 5. Again, hopefully you have the form off my website with the cases on there. 4-month-old male neutered mixed breed dog rescued from the shelter, the animal shelter, 2 days ago, coughing and hacking a lot, eating and drinking well, unknown vaccine history. What diagnostics are you going to want to do? Oh, A Milky said, yes, it is. See, everyone jumping in. The traveling vets are here. Awesome. You guys were on with Dr. Adam. You did so good. I love that you Googled it. I would do that too if I wasn't on here right now, I'll be honest. So what are you thinking about this dog? Yes, kennel cough, Bordetella, heartworms, aspiration pneumonia. All those things are potentially on the list. if I said this was a seal type cough, upper airway, expiratory hack, what is going to be your number one rule out for a dog that recently was from the shelter? Dr. Amir says kennel cough. Yes, I am worried about kennel cough in this dog for sure. It's a 4-month-old, so even if you're worried about heartworms, you could look for microfilaria, but I would say it would be uncommon for a 4-month-old to have heartworms that are causing heart failure and a cough yet. It takes a little bit of time for that to happen. So you're suspicious this dog has kennel cough. Ideally, you would do a respiratory panel on this dog, because sometimes they have more than kennel cough. Sometimes there's a multimodal, and they've shown kennel cough is a combination of viruses and bacterial infections. And so I think, hi, what's happening? Just hanging out, right? So is your name Erin? Okay, what school do you go to? What's your story?
I am at Midwestern University in Arizona, and I am in my 4th year. So
awesome. That's so exciting. Well, I mean, it'd be more exciting if we were in a normal world, right? But yes. It's very weird right now. So yeah. If you're thinking this dog has kennel cough, right? What are you thinking about treatment wise? Just in general, have you learned anything about kennel cough and possibilities?
Yeah, so kind of depends, because it can be a viral or bacterial, infection. So you can give an antitussive just to help with the coughing, or even like I've seen a doctor do a steroid as well.
Yeah, I like Timeril P in these guys.
Yeah.
Because it's got the steroid and the antihistamine effect. I personally don't like antitussives majority of the time, because I think dogs cough for a reason. Like, you're trying to get up the mucus, right? And so if you're suppressing that, it actually can cause like more infection to kind of happen. So unless the owners are freaking out about the cough, I prefer the whole steroid antihistamine route 100%. And I think they resolve a lot faster, because they just have so much swelling and tracheitis that they need something that's anti-inflammatory. Antibiotic wise, would you do antibiotics or not?
I think trying the Timeril P is worth it. And then maybe if it's not resolving, then moving forward with an antibiotic.
And I will do that. I will tell people, one, it would self-resolve on its own if we did nothing, but it can take 6 weeks. I mean, it can go on a really long time once they have it. Again, I try to do a respiratory panel, because the other thing is there's some commensal organisms that they'll get secondary infections from. And if I see those on the respiratory panel, I'll probably do an antibiotic. If the dog seems really sick, they're not feeling well and they're not eating as well and they're really coughing a lot and I still suspect kennel cough, I will do doxycycline with my Timeril P. That's probably my antibiotic of choice, because I just think it targets the bacteria that are going to be in that area that are going to kind of overgrow because of the inflammation. But I do think, someone wants to know what a respiratory panel is. Do you know what a respiratory panel is?
No, not really.
So it's like a PCR test, so like a DNA test that you send to the lab, and you swab the conjunctiva of the dog and you swab the throat. And it checks for, it checks for distemper, it checks for mycoplasma, it checks for Bordetella, it checks for all the different things that could be in the respiratory tract. And then you get it back and you can kind of say, okay, it's multimodal, or this is what's going on. Because the other thing with the unknown vaccine history in a coughing dog is distemper can present as respiratory initially, right? And so if you miss that, it can be really a big deal. So a lot of times in these puppies, I will try to do a respiratory panel just to make sure that I'm covering all my bases. But you're right, a majority of the time it'll self-resolve. If you kind of control the cough, they'll work through it. Would you vaccinate this dog or not when it was in?
I wouldn't yet until this is resolved, so the immune system can focus on that.
I usually, and if we're going to put them on a steroid, right, we usually don't want to vaccinate. So I will try to tell them, like, let's get through this and we'll recheck in like 7 days, and, you know, we can do vaccines then. And I'll tell them, like, I won't charge an exam then, but I want to make sure they're healthy enough to be vaccinated. And owners like that too, right? Because you're like thinking about their pet and you're trying to make sure you offer like best medicine, and it can be annoying for them to come back, but when you explain it, like, we don't want to overwhelm the immune system, people are like, oh, I love that, you know, like, you're not trying to over vaccinate my dog. So good job, you did good. So all right, well, I appreciate you jumping on here, but I've been seeing your answers and you've been doing great, and good luck in 4th year, and definitely keep me up to date on what's going on. Okay. All right, yeah, bye. All right, guys. So, Hillary's, if it's an animal shelter, would you just vaccinate in case, just to shelter, should I isolate them for a week? Ooh, so if you're in a shelter and you're worried about outbreak, a majority of the time they will vaccinate. Yes. And I think that is okay. Shelter setting is a really different type of medicine. So I would do Timral P majority of the time if the dog is doing well and just has kind of a dry cough. If I see any evidence of infection, like drainage from the eyes, or the dog doesn't feel well, I will often do Doxy and Timral P. But a majority of the time I'll do something, because these dogs are coughing all the time. They're keeping the owners up at night. And so the owners really want that resolved. Okay, moving on. Case 6, 7-year-old female spayed domestic short hair cat, indoor only, overgrooming the abdomen, causing crusting and redness. So what do I want to do diagnostically? And what are you thinking with overgrooming? Is overgrooming just behavioral? Is there more going on with overgrooming? It's kind of an interesting phenomenon. It's something that cat class should address, I think. I'm going to talk to Dr. Marshall, Dr. Ronigan about that. Okay, so DayDVM said cytology and a flea comb. I think that cytology is really, really important in these guys. I went to a talk and they said a majority of these cats actually have infection. And majority of the time they actually need antibiotics for a significant amount of time. So I used to always think, hey, hi, how are you? Good. Okay. Are you kidding me? Like, my roots right now? I'm like, what is going on? That's okay. So introduce yourself really quick.
So I'm Cindy, and I am helping out my first year at Tufts. Really jealous of everyone else done.
I know. So,
But yeah.
You're still learning, but I mean, you were always like right there answering the questions, and I appreciate like jumping in. And, you know, I always say with class, like, there's no bad answers, like, just, this is just to get you thinking and trying and, you know, kind of starting to work through these things a little bit.
I say stupid things sometimes, but
no.
Just practice. So.
You don't say stupid things. And again, like, I've seen all these cases, and so I kind of know, you know, what's happened, and it's interesting how my brain works one way, but then when I see things people put, I'm like, oh, I can see why you would, you know, think that or consider that. So no, I just think it's great you're on here and you're interacting and you're trying. So, and you're doing so much on Instagram for students, and I just love it. So thanks for joining me. Okay.
Thanks for having me.
So a majority of the time on these guys, when you do a cytology, you see cocci bacteria. And so there's usually 2 things that you need to do treatment-wise for them. Can you think about what those things would be, or what you would consider?
So an antibiotic to deal with the cocci, but then I would wonder about what's causing the itch, whether it was really behavioral or allergy related.
Mm-hmm.
I feel so bad. I feel like cats always get the short end of the stick with allergies.
Yes.
I have seen doctors give Apoquel for cats.
Mm-hmm.
And then I guess steroids are always an option. But
Yeah,
I've seen, as a nurse, I've seen Apoquel work well.
Yeah, I've seen Apoquel. A lot of people use Atopica in cats, especially if this is kind of like a chronic thing. I will say a majority of the time, my cats, it's very seasonal. So I'll see them like twice a year do this. and then we treat them and they do fine, and the rest of the year they're fine. So I do think it's something environmental that flares it up. To me, it depends on the case. So a lot of times atopic is not a bad decision, but it is hard to, again, treat cats long term. And so sometimes I will give them a Dex SP injection when they're at the practice, and that will actually curb the, need to lick and itch as much. I will try to either put a cone on them or like a little onesie, like something to prevent it while the meds start working, and then antibiotic wise, the big thing is you actually need to treat these guys for probably like 3 to 4 weeks. So most of them have like a pretty deep pyoderma, and a lot of times people will do like 7 days of antibiotics. Well, then you won't get all the layers of skin. And so I've been told to do at least 3 to 4 weeks. And honestly, sometimes that's 2 convenient injections. Like we'll do one, they'll come back in 2 weeks, we'll do another. Sometimes it's Clavamox, really anything that's going to get cocci bacteria that the owners can get in the cat. But it is good to be thinking about, like you said, what's the underlying cause. I try to get them on flea prevention, even if they're indoor only, right? Bravecto is a good one because it's like 3 months, and then you just, and you do it in the hospital. Like every time I send them at home, I'm like, are they going to do that? Like, I don't know if they're really going to. So I'll be like, well, you can do this and we'll put it on for you. And they're like, oh, that's perfect. And I know that I'm like, I know it happened. So I think something for itch and antibiotics, and doing the antibiotics long enough are really, really important. So I don't know if that makes sense. Does that make sense?
Yeah, it definitely does. And I think, because I feel like compliance with cats can be tough too, because the cats might not like it. So it makes sense to really care about how long you do it, or because it'll just come back, even if they try not to do it as long, like emphasizing that to owners.
Right. And that's the thing, is like setting owner expectations up properly, and also that this is we're going to treat this, but it's going to take a while to resolve. And it's probably been going on for a little while too. And you just noticed it. Cause I feel like cats all the time, it's like, it just happened yesterday, but I'm like, this has been going on a while. Like, you just noticed it yesterday, but it did not just happen yesterday, So, okay, well, I just appreciate all your interaction and support. So I just wanted to have you pop on and say hi, and you're doing a great job, and good luck in second year coming up, right?
Thank you.
All right, we'll see you later. Yeah, you'll make it. You'll do it. All right, bye. Okay, so dexamethasone is the same as Dex SP. Dex SP is a higher concentration. It's 4 mg per mil dexamethasone versus just the straight dexamethasone, which is 2 mg per mil. So it's a different concentration. So I use dexamethasone SP, higher concentration. Awana Murphy says Depomedrol injection. Depomedrol lasts too long, in my opinion. I hate Depomedrol unless I absolutely have to do it. And usually for these guys, they don't need a steroid as long as that. I do Depomedrol for other things in cats, but it's going to last a while. And I don't want to put something in a cat that's going to last that long if I absolutely don't have to. Okay, let's move on to case 7. We have 2 more and we have 20 minutes. Okay, an 8-week-old male puppy presents for diarrhea. It was obtained from the breeder 3 days ago. It's received Pyrantel, which is Strongid, several times in the past week, and the puppy has really bad diarrhea. So what is my test I'm going to absolutely do on this puppy? The puppy's acting fine, it's doing well, it's just having lots of stool, frequently, diarrhea. And it's their new cute little puppy that they just paid tons of money for. So what is the one test I really, really need to do? So a lot of people said parvo in a puppy that is acting fine and is eating well and is just having diarrhea. Yes, I want a parvo test. More importantly though, what do I want? Yes, Christine, I want a fecal. I need a fecal in this puppy because it is acting fine. Parvos can act fine, 100%. Like, I'm not saying a parvo can't, but I need just a basic fecal on this dog. It came from a breeder. It's just gotten Strongid, Hey,
Hey,
how's it going?
good.
I haven't seen you in a while.
Yeah, I've just been busy with school.
At home, right? Okay. Are you in College Station or are you?
Not at the moment. I'm to visit my mom in New Mexico.
Oh, nice. Okay. Introduce yourself. Just because I know you doesn't mean everyone else knows you. So,
Hi, so I'm a student at Texas A&M. I am going to start my third year coming up here in August. So, yeah.
it's so exciting. And I spoke there and we got to hang out a little bit and you introduced yourself. So, okay, if this puppy's had strongid, I'm less worried about like hookworms, roundworms, those things. But what are the things that I'm still concerned about that I could see on a fecal?
So I'd be worried about whipworms and then also Giardia and also kind of maybe Toxoplasma, just kind of out there. But I like with puppies, even if they've been dewormed, you don't know if it was also proper dosage and
Yes.
frequency, so you still want to check for all that roundworms and hookworms and such.
Yes, and I've had puppies that have gotten like a bajillion doses of Strongin and Praziquantel and all these things, and I don't know if the breeders didn't keep them stored properly or if they didn't dose them properly. They still are loaded with worms. So this puppy had coccidia, tons and tons and tons of coccidia, which again is a protozoa and it doesn't respond to dewormers. So that's why we would check a fecal. So what would we use to treat the coccidia? You know?
Metronidazole.
Metronidazole is probably more Giardia. There's a different antibiotic I like for coccidia. Is there one that stands out to you?
I'm trying to remember.
No, it's okay. I wonder if anybody
It's been a while.
else has an idea. No, it's okay. I mean, that's why we're in this class because we're talking about it. Like, you're not expected to know everything, and trust me, I look up something every single day. So it's interesting. And in Texas, especially, I don't know if you're gonna graduate and stay in Texas or stay in the South, but you need to know your parasites and your, because it's crazy the amount of things that I see in stool samples and in young puppies and in young dogs locally. So Bella Steiner said a sulfa. Yes, Albon is usually my choice, or Primor, like one of the sulfa drugs. Sulfas kill coccidia, and so you need to do an antibiotic. And so that's also a really good client communication thing is, yes, I know your puppy was dewormed by the breeder, but I'm still worried about these, things that aren't gotten by a dewormer. They still have loose. And then this is actually one of those things, I'll run it in-house sometimes and I'll show it to the owners, like all the parasites, and they're like, oh my gosh, I can't believe it, and it like makes you, oh, you know what you're talking about, and they trust you, and then you just give them the antibiotic and they're fine. So that's all. So sulfas with coccidia, metronidazole with Giardia, plus or minus Panacur, okay? And hopefully I will get to come to A&M again and see y'all again when everything is over and the craziness is over. So
yeah, that would be amazing.
Yeah, I really enjoyed my visit there and the students, and I like keeping up with you guys on here and seeing how you're doing. So I appreciate you jumping on with me, and good luck with your year, okay?
All right, thank you.
All right, bye.
Bye.
All right, guys, so always check a fecal in a puppy. Always check a fecal, 100%. I don't care how many things a breeder gave it. Check the fecal. Worst thing you do is call an owner and say, yay, there's nothing in the stool. We're not worried about anything, but 80% of the time, there's gonna be something in that stool you need to treat for, okay? We have 15 minutes. Let's do our last case. Nicole says, come back and see us. Yes, I wanna come see you. And anyone else on here that wants me to come to their school, reach out. I wanna come to your school when everything is over. Okay, case number 8, last one. 3-year-old male neutered domestic short-haired cat, crying and straining in the litter box. Large firm bladder is palpated on exam. So what do you think is going on with this cat? What diagnostics do you need to do on this cat? And medication-wise, what are you considering? Come to Lebanon. I wish. I really want to go to Europe. So Dr. Ham says, worried about him being blocked. Yes, I'm so worried about this cat being blocked. Definitely an emergency. So what exactly diagnostically do I need to do, or am I going to start? So an ultrasound is always a good thought, an idea. There's something that I definitely want to do that's a different type of imaging. So x-rays, yes, and a banana. So I need to take x-rays too, because I need to know if there is stones and crystals in that urethra and how difficult it's going to be to unblock this thing, and also see what the bladder looks like. Sometimes, depending on what you see, you need to unblock them, but they also may need surgery, right? And x-rays are going to show you more exactly what's going on in that urethra and not just what's going on in the bladder. Sometimes, yes, Life of Vet is right. Sometimes it's not a stone or crystals or uroliths. It's actually either just a mucus plug, or if they have fluidity, it's just a lot of blood and blood clots. So there's a lot of possibilities here. But you get this cat unblocked, you get a urine sample, you run it, and all you see is blood in it. You can't see anything else because there's so much blood. Sometimes there's crystals. My question is, what are you going to do medication-wise? Does this cat need antibiotics or not? Christine wants to know, would you use contrast x-rays? Not usually. Usually I would just take a straightforward x-ray and see if there's anything obvious. And I will ultrasound them too and see if I see something in the bladder with an ultrasound, because sometimes something will show up on there. But a majority of the time, you're going to see what you need on an x-ray. And then when you unblock them, you need to take an x-ray, especially if they had stones or they had crystals, and make sure everything is in the bladder and you didn't bypass anything with your urinary catheter. So they have cystitis, and yes, you guys are so smart. You do not need antibiotics in these guys every time. We used to always give them Clavamox, like every single blocked cat, and we would always send out a urine culture, and these urine cultures come back negative, y'all. It is usually not infection-based at all, and you're putting a catheter in, you're going to be flushing that bladder, you're going to be putting them on fluids. So I will still do a urine culture on these guys a majority of the time, but I will not start antibiotics unless there is evidence of an infection on the culture. You usually can't see anything in your straight UTI, in your straight urinalysis, because there's so much blood and there's so much sediment because the bladder is so angry. Obviously, you're also going to do blood work on these guys. You're worried about the potassium levels, you're worried about the kidneys, but your basic first thing you're going to do is see what's going on with them. You're going to run blood work. You're going to stabilize them if you need to, unblock them. And medication-wise, I'm going to put them on pain meds. I'm going to put them on anti-inflammatories if their kidneys are okay. And I'm going to put them on prazosin if their kidneys are okay, to decrease the urethral spasm that they're experiencing. Do you normally add KCl to fluids for blocked cats? Usually you're worried about their potassium level being too high, so I don't normally add it. But I try to check lab work before I start fluids on cats the majority of the time, because I am worried about their electrolyte levels. Behavioral modification, yes. Food diet is a big way to manage and control these cats a lot of times. And there's a lot of things you can do behaviorally to make their environment happier. Cat Class actually did a really good whole thing on that the other day, and they should have that up on their website. Bell Steiner, do you have a preference for anti-inflammatory? I like Onsior in cats. I think they eat it and they tolerate it well, and it's a really short course of it. I know some people that'll do Metacam, but depending on the kitty values, that's not my first choice. And I will do buprenorphine, so I'll do an opioid, I'll do Onsior, and then like I said, I'll do prazosin if the kidneys are doing well. Babo said CD diet. Yes, CD stress diet is like my favorite diet for cats that have blocked before. You guys did amazing today. I am really impressed because I threw a couple at you that didn't need antibiotics, and you definitely were on top of it. Toads My Goat said, okay, so both the questions. So prazosin is the medication you give to prevent urethral spasms. I will start that once the kidneys have stabilized. I don't give that if the kidneys are compromised. And usually once they've been on fluids, or even sometimes the kidneys aren't compromised depending on how long they've been blocked. So are there any other questions on here? Any other things you guys have thought of? I so appreciate you joining me in the middle of the day. It's a lot, I know, and I know you guys have so much going on, but I adore you all. I'm so proud of you all, especially all the students that are just still hammering it out at home. and trying to learn. I'm definitely going to save this live. I'm going to have it up on my website eventually. And again, if you want me to come to your school, whenever school's open, reach out to me. I definitely want to meet each of you if I can. And if you missed anything, again, I will have this on my website eventually. You guys are awesome and amazing. Thank you for joining me. If you have any questions, DM me, or you can always, email me. I don't know. But definitely reach out if you need anything. I hope you guys have a really, 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 really great day. And hopefully you get a little bit of a break soon too. All right, guys, I'm gonna go. I gotta get ready for my ER shift. We'll talk to y'all later. Bye, guys.